Every human being has the right to the highest attainable standard of physical and mental health. Countries have a legal obligation to develop and implement legislation and policies that guarantee universal access to quality health services and address the root causes of health disparities. But many countries around the world struggle to provide quality healthcare to their citizens, one of which is Pakistan. Pakistan, officially the Islamic Republic of Pakistan, is the fifth most populous country in the world with over 241 million people calling it home. Each of these 241 million have the right to health. But both the NGO Sehat Kahani and Human Rights Watch reports that more than 50% of Pakistanis do not have access to basic primary health services, and approximately 42% have no access to health coverage. Being a developing country, Pakistan is struggling to provide access to quality healthcare to its citizens. The healthcare system is faced with several challenges, including poor governance, inadequate funding, lack of modern infrastructure, insufficient staff, and poorly trained healthcare providers. In this video, we will look at some of the factors that have led to the dismal state of Pakistan's healthcare system. But first, let's discuss the country's health structure. Under the Constitution, health is primarily the responsibility of the provincial government except in federally administrated areas. Public healthcare in Pakistan follows a three-tiered approach. The first level includes basic health units or BHUs and rural health centers or RHCs. Secondary care, or the provision of acute ambulatory and inpatient care, is done through Tehsil Headquarter Hospitals or THQs and District Headquarter Hospitals or DHQs. Tertiary care is offered by teaching hospitals. On paper, it is a layered and strategic model. In practice, it often fails to deliver. A 2023 Lancet study placed Pakistan at 154th out of 195 countries in terms of healthcare quality and accessibility. Pakistan's performance on the Global Health Security Index is also low, with a rank of 130 globally. One key reason is the lack of government funding. In 2021, Pakistan spent only 0.84% of its GDP on healthcare, less than a third of what other lower middle income countries spend. In real terms, that is $38 per person, far behind India, the Philippines, and Ghana. Out of 189 countries, Pakistan ranked 176th in healthcare spending as a share of its economy. The bottom line, the government has not made funding healthcare a priority. While public healthcare spending is not a sufficient condition for ensuring the right to health, adequate spending is a necessary one. Population growth is another factor that adds further pressure on Pakistan's healthcare. According to 2023 data, its annual growth rate is at 2%, higher than other South Asian countries. Pakistan's population has increased by more than six-fold since independence, posing serious socio-economic and health-related challenges. The national health infrastructure comprises 1,201 hospitals, 5,518 basic health units, 683 rural health centers, and 731 maternity and child health centers. The total availability of beds in these health facilities is estimated at 123,000. If we do the math, this translates to one hospital serving 200,800 individuals and one bed accommodating 1,953 individuals. Another pressing issue is the shortage of healthcare professionals. The doctor-to-patient ratio stands at 1:1,000, 10 times lower than the World Health Organization's recommendation of 1:100. In rural areas, the shortage is even more pronounced. In countries where government initiatives fall short, the private sector bridges gaps in healthcare service delivery. Charities and nonprofit organizations play a crucial role in Pakistan's health sector. In many parts of the country, a primary source of these donations is zakat, an obligatory form of charitable giving in Islam, one of the five pillars of the religion. It involves donating a portion of one's surplus wealth to those in need. Zakat represents a significant channel through which redistribution and social protection works in practice. Pakistanis are considered some of the most charitable people in the world, donating an average of about 15,000 or $55 to zakat. With over 50 million individuals contributing, an estimated total of 500 billion Pakistani rupees or $3 billion is collected annually. While there is no definitive data on healthcare being the largest recipient of zakat in Pakistan, there is strong evidence and a clear rationale for it being a major recipient. This is used to fund free clinics, to give free medicines, and to help in the surgeries of those who cannot afford treatment. Sadly, similar to public funding, private donations mainly support curative efforts with little spent on preventive care. And yet, a strong health system is not just about statistical measures. It is about economic productivity, social stability, and human dignity. When people are healthy, societies prosper. When they are not, nations falter. So, will Pakistan catch up with some of its global contemporaries in terms of healthcare delivery? Will it choose health as a national priority, not a forgotten footnote? Will 241 million Pakistanis finally be able to enjoy their fundamental right to health? The answer depends on what comes next.